Well, it's time for another Divers Alert Network webinar. I hope everybody's going to enjoy it. Just officially welcome to everybody. For those that don't know me, my name is 𝗪𝗓𝗧𝗪𝗘𝗕 𝗪𝗘𝗕. I'll be your host today, and I'm also the Dan Southern Africa CEO. Thank you so much for joining the webinar. I know your time's valuable, so I hope that you're going to find this webinar informative. And I trust that everybody's doing well and that you're safe and healthy wherever you are in the world. Now, the talk topic, one that a lot of people are interested in and have asked me for. So it's COVID-19 research for divers. A couple of basic housekeeping rules. You'll find that you're muted and your video is turned off. That's just the webinar setting if you're not sure about that. And please use the chat box to introduce yourself and tell us where you are in the world and what your expectations are for the webinar. That'd be nice. And during the webinar, please use the Q&A box if you have any questions, and not the chat box, so that we can keep track of those questions. Now, as usual, the webinar replay will be available tomorrow via the Dan Southern Africa YouTube and also Facebook channel, so keep a lookout for that. And for the folks that have registered via the Zoom registration, please stick around till the end of the webinar. I usually have a lucky draw there. And the prizes today would still the 3 Dan buffs. So 3 lucky winners will win that. So this is what they look like if you haven't seen them before. So yeah, stick around for that. For the folks that have joined us via Facebook, the live stream, great to have you on board. I hope you're going to enjoy that. Now, let me do the formal introductions. Our guest speaker is Frauke Tillmans, and Frauke is the research director at Dan America. She has a degree in human biology and a Ph.D. in oxidative stress, which is associated with acute diving injuries. Now, Frauke is experienced public safety diver, scientific diver, and dive safety officer, and she has worked as a researcher in global collaborative projects focused on decompression stress, inert gas narcosis, and oxygen toxicity, and was employed by the German Navy before she began working for Dan in 2019. So loads of experience, and Dan team's lucky to have her on board. So I'm sure you guys are going to enjoy her talk this evening. Now, just a quick overview of the talk, COVID-19 research for divers. Now, since the start of the ongoing pandemic, Dan has received inquiries from concerned divers to know what the effects of COVID-19 or the infection might have on their return to diving. Now, early publications suggested major long-term health impacts on divers and caused some controversial discussion between divers, and I remember these, and in the scientific community as well. So in response, Dan launched a survey-based 5-year prospective study to follow divers with confirmed or suspected COVID-19 infections to determine how divers' health will be affected by the virus. So I'm sure loads of people are interested in that. That's my formal introduction. Over to you, Frauke. Thank you so much for making the time to speak to the Dan Southern Africa divers and whoever have joined outside the region. I hope everybody's going to enjoy the presentation.
Let's get started. Thank you for that awesome introduction. It's always good to hear what all I have done. Sometimes I tend to forget. That's great. Thank you everyone for tuning in. This is, it's my pleasure. I've been looking forward to this talk for some time now, because it's always great to talk to interested people in the scientific community and at the scientific conferences. It's not always the people that are most interested, but the people that are trying to find the loopholes in whatever you're presenting. This is different with divers. Divers are just generally interested in their health and in what Dan is doing. And thank you all for being here today. So similar to Monet's housekeeping, I'm going to start with a few basics so that everyone is kind of on the same page concerning what I'm talking about, so that we all know what this stupid virus is and what it does and so on. So the disease that we're talking about is coronavirus disease 2019, COVID-19. And the virus is an envelope virus called SARS-CoV-2. And envelope really only means that it has this layer of lipids, of proteins around it that will protect the viral genome from being attacked. And this envelope will help the virus to attach to whatever it wants to infect, to open up and get this viral genome, the RNA, into the host, which could be you. It survives on surfaces. We've put an article together on that. I'm happy to share those slides, by the way, afterwards. If you want a copy of those, just send me an email. The great thing is your first measure of defense is soap and water. And then the second measure of defense would be disinfectants or sanitizers if you don't have soap and water at hand. But this lipid envelope around the virus can be broken down by soap and water. It is as easy as that. So keep washing your hands. This is something that hasn't changed since the pandemic started. So what we know about the virus today, or the disease, is that the incubation time back in May was predicted with 2 to 14 days, and that is still holding. It's something between 12 and 13-ish in the maximum now. It will start with, it will have all kinds of respiratory symptoms, so a cough or difficulty breathing. And you will have to have at least 2 of the following to make it a suspected COVID case: fever, chills, repeated shaking, a sore throat, headache, muscle pain, loss of taste and smell, confusion that isn't normal for you. All of those are symptoms of this disease. How is it spread? We have heard a ton about microdroplets, and that still holds. So the reason why you're wearing a mask is to keep those microdroplets from your speech when you talk to people and yourself. It is probably or very likely transmitted from hand to mouth, eyes, nose. So any orifice that you have where the virus can enter, it will. And there's good evidence now. It's not carved in stone, but that it actually is an airborne disease, so that it will transmit longer than you think, sticking around in your surroundings in the air. Again, the most effective or the most critical is these nasal and oral secretions. The treatment is unfortunately almost only symptomatic. So you get a fever, you take medication, you get a sore throat, you take medication, you drink a lot, you have a headache, you take medication, you take care of yourself, you basically treat it like the flu. And if it is a really, really bad case, you need supportive care. So you get into the hospital, and in the worst case, you will get on a ventilator. And people will do everything to prevent the further spread and the development of this systemic infection that might come. The duration of the acute disease, and this is what we knew in May, and this also hasn't really changed, but the mild cases are about 1 or 2 weeks. The very, very mild cases are easier. Some are completely asymptomatic. We see those too. We also have those signing up for our study. But it's important to look at their continued medical story too. And the severe cases can be 3 to 6 weeks, and the recovery might take significantly longer. And we have some of those cases as well that we're following up on. What COVID does to the body, so the virus I just showed you will enter the body through any orifice it can possibly find. It targets the epithelium of your alveoli. And it's great that I'm talking to divers because they all know what alveoli are. So these little air pockets in the lung. The epithelium there is targeted by the virus, and it is being degraded by the virus, and it's making gas exchange very ineffective. It can cause a systemic inflammation affecting other organs, and with other organs, we're talking about blood vessels, the heart, the liver, the kidney. Recently, also neurological impacts have been reported. So this is it is something that can affect everything, which is why we cannot take it lightly. It disrupts gas exchange. It causes hypoxemia, so not enough blood and oxygen supply, which will then lead to dysfunction of basically everything if it's a very bad case. So now research in the beginning of the pandemic was so very early studies with very few patients, or with a lot of hypotheses that had not completely been tested because there was not enough time, have had a really big impact. So we heard a lot about medications that might or might not work. We heard about all the things that the virus could do to us, that even the people that had no or almost no symptoms would never be able to dive again. And this is not true. So careful with conclusions. We didn't have much data then, and we still don't have much data right now. It is getting better, but research takes its time. And I do know that not everyone likes this, and that people, especially divers, like to have a solid advice from people, but research just takes time, and that time has not yet passed. So what is being researched overall? We have fast testing. So in the beginning, we only had this PCR test. We did have an antibody test relatively soon, but we didn't have any rapid tests. That has changed since. So 3 types of tests I would like to very briefly talk about. 2 are done with a nasal swab. So if you go to your doctor's office, or here it's a drive-through, I don't know how it works in Southern Africa, a healthcare professional who knows what they're doing, ideally, will put this nasal swab into your nose, and it should not harm you. It should not cause any injuries, but it is not pleasant. It's not a pleasant experience to do this. So whatever comes out of your nose with this swab will be prepared in the lab, and the virus RNA will get extracted. That will be colored with a specific dye, and then we can see if you have the RNA of the virus in your system or not. And this is a test for acute infection for now. So it doesn't tell you if you had the virus 2 weeks ago. It doesn't tell you if you will have the virus when you go to the truck stop the next day, but it will tell you if you are now infected with it. If this is a negative test, it means that you currently don't have an active virus, so no active RNA, but you might still be infected because you caught it yesterday, and it's just not, it hasn't spread enough, and it's the frequency of the virus not high enough, or the number of virus RNA is not enough to actually detect it yet. The other nasal swab test, same thing, as it pertains to what they do to you, is a rapid antigen test. So this antigen, or again, an infection test, is one of those quick tests, 5 to 10 minutes, basically works like a pregnancy test. Most of you know how that works. It's again, you take that sample out, you prepare whatever is you prepare a solution that you put on that test, or that the laboratory technician puts on the test, and then it will tell you positive or negative for the antigen, so the actual virus. And then the last thing is, and this is not an infection test right now, that is more an exposure test, is if they are taking blood from you. So there's a blood test which is looking for antibodies. So once your body has been infected with a virus, it will try to find a way to get rid of it. And this is with producing antibodies against the virus. This will give you immunity. We're going to talk about that in a minute as well. And it shows that these antibodies will stay in your system and they will show that you have been exposed. It's also called a serology test. This is relatively complicated in terms of how it scientifically works. I'm not going to get into much detail. Important is if you had a nasal swab test, they are testing for your infection. And if you've had a blood test, they are testing for previous exposure. Now, what else is being researched? Vaccines. And I'm really happy because this part I could not talk about half a year ago when I gave the first talk on COVID because there was just nothing there. What's going to happen, and we have a few really, really encouraging results right now, is that the first line of defense, the first people that will get these vaccines once they are approved and out in the open are healthcare workers, and then the vulnerable individuals, and then everyone else. And it is likely that these vaccines are going to be distributed within the next year if everything goes according to plan. But if you are otherwise healthy, even if you're not working in the healthcare business, and if you're not in a vulnerable population or have a predisposing condition that will make you more susceptible to the virus, you will probably be one of the last ones who gets access to the vaccine. This is not bad because we have the means of mitigating and to slowing the spread by what we're doing now, wearing masks, washing hands, physically distancing. So where are we on the vaccines? 2 of them, and this is information, I just stole this slide from my colleague, Dr. 𝗪𝗧𝗪𝗧, who presented this yesterday. 2 vaccines are very promising and are currently in phase 3. A lot of them are in phase 3, which means they have been tested on a number of volunteers and can now undergo application, or can apply for FDA approval. That is what it is here in the States. Every country has their own entity who will have to determine whether it is safe to use and if it can be distributed and how. So one is the Pfizer and one is the Moderna. Both of them have published results beginning of this week, that they have a 94/ more than 95% efficiency of the vaccine that they tested in 44,000 and 30,000 volunteers. This is great news. Now, just in case we have people in the audience that don't believe in vaccines, we do need those. It is of absolute importance that people understand that without this vaccine, it will not get to anything like a herd immunity. We have never gotten rid of any disease with herd immunity. We have always needed a vaccine to speed up immunity in the community. Now, something that you might want to consider, we still don't know everything about the virus, and some questions that are still open. We've discussed a lot about if this virus is seasonal, so higher infection rates and colder weather. I think we got our answer. It is spiking now, and some of it might be due to people starting to slack on the good procedures, but a lot of it will be you are more susceptible to the virus, and the virus probably likes colder weather. Does it change? Does it adapt? At this point, it seems to be a very stable virus. For the vaccine, that is awesome because it doesn't need to change with it all the time. Once it changes, this is bad news. So will have to see how this is gonna work out. With the infected individuals, will they have long-term immunity? This is something that has just been published in a few articles. We don't have the long-term lasting immunity evidence yet. What we do have is we know that the ones that had a very severe outcome of the disease, or where the symptoms were very severe, they usually have a longer lasting immunity, and that means that that at this point we know that severe disease might have something like 7 or more months of immunity, or we can still see the virus or detect the antibodies in there after 7 months. This might be longer, it might be shorter, we don't know. Someone with a very mild disease might not have this immunity for that long. Again, this is why this vaccine is so important. What else is being researched? Treatment. I told you this is mainly symptomatic, so I don't really know if there's going to be anything but optimization of the current treatment for critically ill patients. That is probably something to work on. Infection control, tests of new disinfectants, approval of new disinfectants. This is also very interesting or very important for the diving industry and the community. What disinfectants can I use? And our risk mitigation team, led by Frauke Berman here, has done a terrific job in working on all of that. And then a few more things very specific to the diving community. Fitness to dive after COVID. Can I go diving again? To answer that, you will have to talk to your physician, and you will have to have an exam specifically tailored to your outcome, to your disease, how it was, how severe it was. There is no one-size-fits-all solution. Unfortunately, I'm sorry to have to tell you that. This is very individual, and that is why I'm not going to go into at length detail on this one. And then the long-term health effects, and this is what we have been struggling with, because there is no long-term exposure to it yet. Everything is 10 months old, if at all. So long-term is really, in science, we would like to classify long-term as several months or years. At this point, with 10 months, we can only make suggestions, let's say. We do not expect, if you had a very, very mild case and a complete recovery and you feel back to normal exercise capacity, that you have to fear long-lasting effects. However, if you do sign up for our study, and if you do talk to our medics and talk to a physician, that is important. We do know a lot of things from previous respiratory diseases, ARDS, acute respiratory distress syndrome, with the need of mechanical ventilation, or in a very severe case where you were majorly impaired and your exercise capacity has gone down to almost zero. Yes, you might have to face decreased lung functions. You might have scars in your lung tissue following this infection. There is a risk of cardiomyopathy and arrhythmias, and maybe a kind of hopefully temporary exercise intolerance. But this is something that hopefully the individual, in collaboration with a physician, fitness coach, and nutritionist, can work on. There's a webinar available, or there are a lot of webinars available on this topic, or generally on COVID-19 and diving. If you follow our YouTube channel, Dan TV, you see one of the links that will give you a full list of all the webinars we did during the beginning of the lockdowns here. This is what it looks like, right? forgot that I put that in here. So these are the webinars that we did in between May and August. So long-term effects, why are they still unknown? Pretty easy to say because there's less than 10 months recovery after the first case as of today. The mild cases are presumably not long-lasting, but we don't know too much about it. These heart problems, we will have to look at this if we see that we do have a lot of reports from people that even after recovery and they feel that they are back to normal exercise routine, still feel that during the dive they have a respiratory distress, so they don't breathe normally. This is something we're following up on. So now this brings me to the study that we're currently doing. And please don't click on any links right now or take the QR codes, because I want to finish this talk first. But as I said, I'm happy to send all of this to you. So it's a 5-year prospective study, and you are eligible to sign up for this if you had COVID, suspected or confirmed. Confirmed is one of those 3 tests that I talked about. Suspected is you had all the symptoms, but you've never made it to your physician to get tested. You have recovered or are still recovering, and you have returned to diving or you're planning to. And then the things we want to know are how bad was your infection? How long did you stay at home? Have you fully recovered or not? Are you still recovering? Are you seeing a physician for return to diving, or are you just saying, nah, I'm feeling good, I'm going anyway? So all of this is information we would like to capture. And then what happened during your first dive and during consecutive dives. The initial survey will take you 10 to 15 minutes. It's a one-time registration. You go through it, you consent to, we explain everything. You go through a consent process, and then you answer all the questions. Depending on where in the questionnaire you click yes or no, you're between 20 and 40 questions. The follow-up questions that we are going to send to you, that is nothing you can sign up for. That is if we enroll you in the study, and so far we haven't kicked anyone out, is basically looking at the same things, but it's only 5 to 10 minutes. Just checking up on you after a month, after 3 months, after half a year, and then once every year if something has changed from the last time you took the survey. How severe was it? Have you seen a physician? Did you return to diving? Do you want to return to diving? Do you know someone who is eligible for the study? If you have any questions, if you're not quite sure if you're eligible, if you had a test a week ago, but it turned out to be negative, but you had all the symptoms and you're sure that it is, email us or just sign up and we will follow up with you and see where you stand here. Right, so I'm getting close to the end here. What I want to give, if you didn't take anything away from here, I want to encourage you to make wise choices. Wise choices is make good decisions for yourself and your loved ones. Avoid exposure. Assume that everyone is a potential carrier. That is why we do all this physical distancing. I don't like the word social distancing. It has become that, but it's keep a physical distance from people that might be a potential carrier. Protect others. Wear a mask. So with the normal masks that you find everywhere, these that you can buy everywhere, what you're doing is not protect yourself, you're protecting others. So do your part to protect your community by wearing a mask. They work, despite some news channels telling you otherwise. We have good evidence that masks work as in slowing the spread. comply with federal and state physical distancing orders and stay up to date in their recommendations. So in the US, for example, this is different from state to state, what they want you to do, what they don't want you to do, what the shops or the bars or the fitness centers can do or cannot do. I am not going to read up on all of those. That means you have to do it. That is your part of the equation. You need to find out what you need to comply with to stay safe. This is really, they don't want to punish you. Your government and your federal and state regulatory organs want you to stay safe. And then your best defense is still soap and water. Keep washing your hands. Don't get slacky on that one. Please keep washing your hands. That is the best thing you can do to destroy the virus once it starts attacking. Rumor control, find trusted sources of information. Not gonna say the names of some of the news channels I don't mean, but you know that some news are better than others. So share information from these trusted sources and discourage others from sharing all kinds of crazy information from unverified sources. And I said that yesterday during one of my talks at the virtual Lima. Talk to experts, talk to physicians instead of consulting Google, because Google does not have a multi-year medical degree. It will give you exactly the information you want to read and you have been reading for the last few months, and that is not what you need. Right, these are some of the trusted sources I'm talking about, especially pertaining to the virus. And with that, I'm just going to give you these. Please email me for questions, or if you have general questions, anything on medical, anything on safety and preparedness, anything on research in general, you can always email medic@dan.org, risk mitigation@dan.org, research@dan.org. And all the DAN entities, DAN Europe, DAN America, DAN Southern Africa, DAN Japan, we all have a lot of information online and on our various social media channels. Please don't hesitate to look for information there. We also have our medical information line. This one is the American one. Again, DAN Europe has their own medical information line. We do have emergency lines if something goes completely wrong right now. Please use us as a resource, because that is what we're here for. Our membership is there to support us helping you. So this is, thank you for everyone who has been listening today, and for everyone who is continuously paying their membership fees and their insurance dues. That is what keeps the light on for us. So thank you for that. And with that, back to you, René.
Wow, thank you very much. Very informative, loads of information. And yeah, Frauke, I mean, if you've got your slides and you're happy to share that, you can pass them on to me, and I'll make them available to the folks that'll get their follow-up email tomorrow. But before we jump into all those resources and things, I see we've got two questions. I don't know if you can see them or if you'd like me to read them out loud, Frauke. Let's
see. Yeah, you go ahead.
Okay, so two questions from Joe. The first question is...
Hi, Joe.
All right, so Joe wants to know, so how does the immunity work with IgG does not remain, and people may have had it twice? I think that's the sentence he tried to write there. Does that
you're absolutely right. There is this immunity might be short-lived. We don't know it yet. Again, we're at a stage where everything is still experimental and scientists are still learning. We're both in that group of people that still have to learn a lot. So yeah, just like for the flu or for any other virus that might attack you, the immunity that the vaccine or the actual being infected and making the antibody yourself part will give you this safety might only be for a short-term period. We will have to monitor that.
Yeah.
As I said, at this point, for the very severe cases, it seems that the immunity seems to be longer. But yes, there have been several cases that have been reported where someone had the virus a second, a third, and a fourth time. But we don't really know if the second time around the symptoms were less severe than the first time. So it's a waiting game at this point.
Yeah.
Hope that answers the question.
I think that's great feedback. And again, you know, the challenge remains. It's the early stages. We want answers. We just don't have enough data. Not enough time has passed. But we're working hard at it, or at least you and your team are. Frauke, yeah, another question from Joe. He says, vaccine is mRNA based. I understand it is the first vaccine to do so. What are second and third order consequences of changing mRNA? And moreover, how can drug companies ensure immunity when the current IgG does not last? Wow, that's quite a big question. I don't know how you feel about it.
That's a heavy one.
Yeah.
It's a heavy one, and it basically goes into the same in the same direction as I've pointed to before.
Yeah.
What we have now in the vaccine is encouraging because it shows that it was effective in a large percentage of the people that were volunteers. We do not have any news about the long-term effects, but it is our best bet to start with this vaccine, even though we don't exactly know what mRNA changes might have as a consequence for you. I do understand that people are worried that this might change something significant. On the other hand, we really don't have any better options at this point. So obviously everyone is free to say, nah, the first year I'm not going to take this vaccine because I don't know what it does. That is what people have done with the measles too, and with polio, and with all other kinds of vaccines that are that then have been smashed really by groups of people, media, scientists on one end or the other end, that have told people this is bad for you, this will cause autism. And what really happened was not that. So please, yes, it is important to stay cautious and to stay up to date and to take all information we can possibly get in at the time. But don't encourage people to stop everything altogether, and don't go for the options that we are presenting, because I think it is this is, I think, the baseline. This is our best bet at this point. Herd immunity will not happen. We will not infect, or not we haven't infected and we won't infect that many people in the community that the spread will stop. And if we do, it's going to be with a lot of deaths on the way. And that is not only an economic problem, that is at the very first, it is an ethical issue.
Yeah.
I think that is what I would want to say to that.
All right. Yeah, a lot of things to consider. I'll allow the folks that are on the webinar, there might be some more questions, but in the meantime, a little bit of fun just before we start wrapping up. It's time for that lucky draw. If everybody can just give me a minute or so, I just want to punch all the names of the folks that registered via Zoom into my random online name picker. So just give me a seckie. Let me just get into that, and I will do my bit to get that sorted. All right, here it goes. I'm going to click and see who are the winners. All right, great. I've got 3 names. First winner is 𝗥𝗘𝗦𝗘𝗥𝗑𝗣𝗟𝗏. Second one is 𝗪𝗑𝗪 and the last winner is 𝗪𝗪 van Staden. So I'll be in touch with you folks early next week so we can make arrangements to get those Dan buffs to you. Let me just see any other questions for those folks that still have any for Frauke. You have a bit of time left before we start wrapping up. Just from my side, Frauke, thank you very much. Very informative. A lot of good things. And for the folks that have joined, please, if you know anybody or if you have been affected by the COVID virus, make sure that you participate in that study. Over the last month or longer, I've been promoting it via social media and some of our email correspondence. It'll be in the follow-up email as well. And yeah, tomorrow in the follow-up email with a replay link, I'll have a whole bunch of Dan goodies and freebies giveaways. And one of them would be quite a lot of the things that Frauke mentioned, some of those COVID guides, the webinars and so forth. So I'll add those links in there. You'll also get access to the alert divers, the online version, the annual reports, and I'll give you access to that dive safety portal with over 8 hours of dive safety content that you can enjoy at your own leisure, you know. So yeah, and then as Frauke said, for those folks that are Dan members that keep paying their membership dues, thank you so much for your support. Those dues don't just go towards assisting and saving lives, but also help promote research, keeps the hotline going, the risk mitigation team, and so much more. So thank you very much. And for those folks that are on the call today that haven't joined just yet, yeah, easy enough. If you from the Dan Southern Africa region, the best place to find information would be on our website, which is www.dansa.org. If you're from the Dan America region, very easy, dan.org. And from Europe is daneurope.org. And I haven't seen any folks from Japan and so forth, but you're more than welcome to reach out to us. Okay, I see just before I wrap up, there is another question. Yeah, okay, just thanking us very much. So everybody seems fine. And Sumari says, thanks very much. It makes me feel very special. Oh, okay, winning the buff. Great stuff. Frauke, you said you're also quite keen on a buff, so we'll have to make a plan to get you one. Either next time you come and visit us, or if I go visit you guys, or maybe Michael that's on the call goes across to the States. From my side, it's been great having you, everybody. It seems like most folks stuck around right until the end. It's great to have you on board. Frauke, anything from your side before we say cheers to all the folks?
Well, no, just another thank you for everyone. Great to have this interested crowd here. Thank you for the questions. Joe, if that wasn't the information you were looking for or the answers, give me a call. You know how to find me. Yeah, thanks everyone. These slides will be available. I'll send them to Mornay sometime over the course of my day, and then he will send them to you if you want. If you have any other questions, please reach out. That's what we're here for. And thank you so much, and have a great rest of your weekend.
Absolutely. Thank you very much, everybody. That's us for now. Overnight. Enjoy the rest of your Saturday and weekend. Ciao. Goodbye.